Hello friends, welcome back to Medico Srinjoy. Today our topic is pulp. First, let's start with the question, what do you mean by pulp? Friends, comment this answer in the comment box. Next, let's start with the topic. First, the volume of the pulp in a single tooth is about 0.02 cc and the total volume, that is all the teeth, is 0.38 cc. Both these questions are very common in the Viva table, so please remember these two values. Next, let's start with the anatomy of the pulp. The structures of the pulp consist of mainly 10 types of anatomy. These 10 types are the intercellular substance, the fibroblasts, the fibers, the undifferentiated mesenchymal cells, and next we have the odontoblasts, the defense cells, the blood vessels, the limbs, the nerves, and the nerve endings. We have to learn these 10 different anatomical parts of the pulp in details in the upcoming slides. So let's start with the first anatomical part of the pulp, that is the intercellular substance. So what do you mean by the intercellular substances of the pulp? These intercellular substances of the pulp are dense and gel-like in nature, and these are composed of the glycosaminoglycans and the proteoglycans. Friends, remember these two names, that is the glycosaminoglycans and the proteoglycans, are present in the intercellular substance of the pulp. Also, glycoproteins are present in the ground substance, and during the early development, chondroitin A and chondroitin B and hyaluronic acids are also present. Next, we have to learn about the fibroblast. These fibroblasts are the most numerous types of cells in the pulp. These fibroblasts are the stellate shaped cells and are active in the protein synthesis and cell division in the young pulp. In older pulp, it appears rounded or spindle like and exhibit fewer organelles, and then these fibroblasts are called as the fibrocytes. Next, we need to know that the fibroblast forms the pulp matrix and have the capability to ingest and degrade the same matrix. Next, we have to learn about the fibers. What are the fibers in the pulp? These fibers are diffuse and bundle of collagen. So these are the collagenous fibers, and these fibers are scattered throughout the pulp. Next, we have the fourth anatomical portion of the pulp, that is the undifferentiated mesenchymal cells. These undifferentiated mesenchymal cells are totipotent in nature, and when they may become odontoblast, fibroblast, or macrophage depending on the need of the tissue. These mesenchymal cells are found mainly in the young pulp, and very less are seen in the older pulps. Next, we need to understand the odontoblast. These odontoblasts are the second most numerous types of the cells in the pulp. If you don't know odontoblast, please see the dentin portion of the videos in my playlist. Next, we need to understand what are the defense cells. Defense cells of the pulp are mainly histocytes or the macrophages, mast cells, plasma cells, blood vascular elements like the neutrophils, basophils, lymphocytes, etc. Next, we move on to the blood vessels. Pulp organ is extremely vascularized, and these are supplied by the superior and the inferior alveolar arteries and some veins in the maxilla and the mandible. Some small diameter of arterioles are present. These are called as the precapillaries. Next, we move on to the lymph vessels. What are these lymph vessels? These lymph vessels are draining anterior teeth and pass to the submental lymph nodes, while the posterior teeth passes to the submandibular and the deep cervical lymph nodes. Friends, you need to remember these two names. Next, we move on to the nerves. What are the nerves present in the pulp? Majority of the nerves that enter the pulps are non-myelinated and sympathetic. So they are mainly non-myelinated and sympathetic. Also, there is a zone called the cell-free zone, which consists of network of nerve fibers are present, which lost their myelin sheath, and this is called as the plexus of Raschkow. We will study this again in the upcoming slides. That is the plexus of Raschkow. Next, we have the nerve endings. These are the afferent endings of the trigeminal cranial nerves. You need to know the name, that is the trigeminal cranial nerves are the nerve endings present in the pulp. Next, we will move on to another major topic of today's lecture, that is the zones of the pulp. What are the zones of the pulp? Zones of the pulp are mainly of four zones. These are mainly cell free. First, we have the odontoblastic zone. Next, we have the cell free zones, or the also called as the subodontoblastic layer, also called as the cell free zone of Willis. Third, we have the cell rich zone, and fourth and the final one, we have the pulp core or the pulp proper. Okay, pulp core or the pulp proper. Finally, let's start with the each of these zone one by one. That is, first is the odontoblastic zone. What does this odontoblastic zone consist of? This zone is present at the periphery of the pulp and contains cell bodies of the odontoblasts. Odontoblastic layers as well as the subodontoblastic nerve combines to form the sensory complex and envelops the central pulp core. Next, we have the second part, that is the cell-free zones of Willis. What are these cell-free zones of Willis? These are 40 micrometer layer which does not consist of cells. So these are devoid of cells, and they are prominently seen in the coronal pulp and decreases in size when the dentin formation occurs at a rapid rate. It consists of a network of nerve fibers which lost their myelin sheath and are called plexus of Rashkow. We already learned this in previous slides. Next, we have the cell-rich zone, or the zone which contains numerous cells. This is a narrow zone. Okay, this is a narrow zone which have the high density of undifferentiated mesenchymal cells, fibroblasts, macrophages, and the young collagen fibers. So this act as a reservoir for replacing the destroyed odontoblasts. This zone is both seen in the coronal and the reticular pulp. Next, we move on to the last part, that is the pulp core or the pulp proper. This is a core of loose connective tissue with rich cellular elements and also consists of large nerves and the blood vessels, which branches towards the peripheral pulp core. Next, in younger pulp, this zone consists of more of the cells, but in older pulp, more fibrous components are present. So friends, let's move on to the next major topic of today's lecture, that is the functions of the pulp. Mainly, pulp has 5 functions. These are inductive function, formative function, nutritive function, protective function, and the defensive or the reparative function. So let's study each of these 5 functions in detail in the upcoming slides. First, we have the inductive function. The pulp anlage, or in simple words, the dental papilla, interact with the oral epithelium cells and cause the differentiation of the dental lamina, and so the enamel organ formation occurs. Also, interaction with the enamel organ, and it determines the particular type of the tooth. Next, we have the formative function. Pulp organ cells, or to be more specific, the odontoblasts, produces the dentin, and the pulpal odontoblasts leads to the development of the organic matrix, so clearly it helps in the calcification. Next, we have the very important function of the pulp, that is the nutritive function. The pulp nourishes the dentin through the odontoblast and their process. It's a very important question for the university exams, that is the what are the main functions of the pulp. This is a nutritive function. Next, we have the protective function. This pulp has a sensory nerves in the tooth which respond with the pain to all the stimuli. So the nerves also initiates the reflexes that control the circulation in the pulp. Finally, we have the fifth function, that is the defensive or the reparative function. Pulp responds to the irritation, whether mechanical, thermal, chemical or bacterial, by producing reparative dentin and mineralizing affected tubules. So this completes the functions of the pulp. Friends, please remember these 5 functions of the pulp. These are very common in the university exams. Next, we have a very crucial topic, that is the regressive or the age changes of the pulp. With age, the cell number decreases, cell size decreases, number of organelles decreases, and the odontoblastic processes also decrease. With age, the fibrosis or the increase in the fiber occur. Also, the calcification of blood vessels increases, size of the pulp decreases, and the sensitivity or the healing potential decreases. Also, there occurs the pulp stones or denticles increases. So friends, what do you mean by the pulp stones or denticles? Let's study this. These denticles are nothing but the nodular calcified masses. So these are nodular calcified masses which are present both on the coronal or the root portion of the pulp. Depending on their relation to the dentine of the tooth, pulp stone is of 3 types. First, we have the free denticles. These are entirely surrounded by the pulp tissue. These are entirely surrounded by the pulp tissue. Next, we have the attached denticles. They are partially fused with the dentine, while the embedded denticles are entirely surrounded by the dentine. All the above denticles form free in the pulp, but later they become attached or embedded as dentine formation progress. Also, depending on their structure, pulp stones or denticles are of 2 types. These are true denticles and the false denticles. So what are true denticles? True denticles are the remnants of the epithelial root sheath, and they induce the cells of the pulp to differentiate into odontoblast, which then form the true pulp stones. These true pulp stones are very rare and found near the apical foramen. Next, we have the false denticles. So what are these false denticles? This appears as the concentric circles of the calcified tissue. These are found in the center in a concentric layer of the calcified tissue, and they may be remnants of necrotic or calcified tissue. With this, we complete our lecture on the pulp. Next day, we will study a very important topic in the dental histology, which is the cementum and the cementogenesis. Friends, if you like my video, please share with your friend and subscribe my channel for more videos like this. Thank you friends, keep supporting.